Have you ever wondered why your doctor asks like a million questions about what seems like a simple rash? Well, it's because dermatology is actually a lot like a detective story. So today, we're going to explore how your doctor basically becomes an investigator, piecing together all these little clues to solve the mystery of what's happening with your skin. All right, let's dive in.
I mean, you know the scene, right? You go to the doctor for a rash, and suddenly, you're getting grilled about your job, your stress levels, what kind of laundry detergent you use. It can feel totally random. But here's the thing. What if every single one of those questions is actually a vital clue in a much, much bigger investigation? And that, right there, is the key. Think about it this way. Your dermatologist is the detective. And your skin? Well, with all its unique patterns, flare-ups, and history, that's the scene of the crime. Every little piece of information you give them helps them put the puzzle together and figure out what's really going on. See, they're not just treating a symptom, they are literally solving a case.
Okay, so where does any great detective story start? With the interrogation, of course. In dermatology, we call this the patient history. And let me tell you, it is not just a formality. This is the crucial first phase where the detective gathers all the initial evidence before they even start thinking about suspects.
All right, let's open up a really common case file. Eczema. The detective's first move is to survey the scene. They're going to ask about the what, where, and when. You know, things like, okay, where is this rash? What does it feel like? Does it follow any kind of pattern? Like, does it get way worse at night? All these questions help establish the basic facts of the case and kind of map out the boundaries of the investigation.
And then, the investigation starts to widen. Does your job mean you're washing your hands constantly? Been under a lot of stress lately? Does anyone in your family have asthma? I know, these questions can feel like they're coming out of left field, but the detective is actually searching for accomplices here. You know, external triggers and even genetic links that could be a huge part of the story.
And this is a great example of how the questioning changes depending on the case. So if we're investigating acne, the focus might totally shift to your diet. A simple question about what you eat can draw a direct line from a lifestyle choice to what's happening on your skin. And that can be a major breakthrough.
So, once the initial clues are gathered, what's next? It's time for the lineup. This is where the detective creates a list of all the potential culprits that fit the evidence so far. In the medical world, this has a fancy name, a differential diagnosis. But really, it's just the list of usual suspects for this particular crime.
So, let's look at how a doctor tells two suspects apart. On one side, you've got vitiligo. That's patches of skin that have lost their color, and it usually spreads pretty slowly. But then on the other side, you've got urticaria, which you probably know as hives. These are itchy welts that can literally appear and disappear within hours. Their modus operandi, if you will, is completely different, and that helps the detective start narrowing down the list.
Okay, now we get to what is maybe the most critical step in any investigation: assessing the immediate danger. In medicine, these are called red flags, and these are the signs and symptoms that tell a detective to, stop everything and call for backup because the situation could be really serious.
And this is a list you really, really don't want to ignore. We're talking about things like sudden swelling, changes in your vision, or a fever. These can all be signs of a much more dangerous underlying condition. A red flag basically screams at the doctor, hey, this is not a routine case, and it might mean they need to act fast. At the end of the day, these questions are all about keeping you safe.
Okay, so the suspect's been identified, the danger's been assessed, now it's time to crack the case. But the treatment plan isn't some magic bullet. Nope. Just like a good detective strategy, it's a logical, step-by-step approach. The whole goal is to resolve the situation effectively and, most importantly, safely. So what's the foundation of a lot of these treatment plans, especially for dry skin? It's something called an emollient. Now, this is not your average everyday moisturizer. Think of it as a therapeutic tool, something specifically designed to repair and restore your skin's natural barrier. It's like securing the perimeter of the crime scene before you do anything else. It's that foundational.
And doctors have a really smart way of doing this. It's often called a stepped care approach. Basically, they start with the gentlest, most foundational treatment, like that emollient we just talked about, and then they just watch and see how the skin responds. They only escalate to stronger treatments if, and only if, that first step isn't quite enough to solve the case.
And here's exactly what that ladder looks like for emollients. If you have really, really dry skin, a doctor, or detective, might reach for a heavy-duty tool like a super greasy ointment. But for a milder case, a lighter lotion might be all you need. It's all about matching the tool to the severity of the problem, and always starting with the gentlest option that might work.
Okay, a quick but incredibly important safety note here. A lot of these greasier emollients are paraffin-based, and that means any fabric, we're talking clothes, bedding, anything, that touches them can become highly flammable. Seriously, this is a crucial piece of real-world advice for anyone using these treatments. Stay away from open flames.
But okay, what happens when that foundational treatment just isn't cutting it? If the inflammation is still there, the detective knows they need to escalate. The next step up that treatment ladder is usually a more powerful tool, a topical steroid.
And yep, you guessed it, just like with emollients, steroids have their own ladder of potency. These are designed to go in and directly fight the inflammation that the emollients couldn't handle on their own. So a mild hydrocortisone might be perfect for sensitive areas, but the really potent steroids, those are reserved for thicker skin and much more severe conditions. And pay close attention to that areas to avoid column, because using the wrong strength in the wrong place can cause way more harm than good. It is all about precision.
So after walking through this whole process, from the interrogation all the way to the treatment plan, what's the biggest takeaway here? It's this. The doctor might be the expert detective, but you are the #1 source of clues. In this whole story, your observations and your personal history are the most valuable pieces of evidence. Period.
So the next time you notice something new going on with your skin, try not to just see it as a symptom. See it as a clue. When you start thinking like a detective about your own body, noticing patterns, triggers, and any little changes, you become an active partner in solving the mystery. It makes all the difference. So let me ask you, what's the next clue you're going to bring to your doctor?